Good afternoon. This is Alan Larson, President and CEO of Sova Health. I'm excited to give the community COVID update report. We're grateful to be able to share with the community the important news of how our hospital is providing care to our community and meeting our mission of making our communities healthier. So as of today, we have 40 patients in the hospital that have tested positive for the COVID virus. That's across our two campuses in Danville and Martinsville. Of those patients who have tested positive, 93% of them have been unvaccinated. Again, the data continues to show that the vaccine is effective in preventing severe impact to the patients who have COVID. You may still be tested positive for COVID after being vaccinated, but the likelihood of being hospitalized or the likelihood of death after being vaccinated reduces significantly. So we again encourage you, if you've not yet been vaccinated, please do so, not only for yourself, but also for the community. It helps us provide the resources we need to other patients so that our hospital isn't filled with primarily COVID patients. A couple of things that I'd like to share with you as well today is around some decisions that were made because of the limited resources available to stop elective or non-urgent surgery. So effective yesterday, we were able to resume our elective or non-urgent surgery back in the hospital. That was 7 days that we were unable to provide those cases. Thankfully, we appreciate the patience of our physicians and our patients. We've been able to reschedule those and get them back in the hospital. Speaking about vaccine, a question that maybe comes up: if I get vaccinated, what might be the side effects? Still some people concerned about the vaccine, especially the third booster. I recently was able to get my booster. I had a little bit of pain in my arm in the injection site, but for me, I did not have any fever or body aches or chills, just a little bit of pain in the injection site for less than 24 hours. The most common adverse reactions have been fatigue and headache. Some people have fever and chills, but for me that was not the case as I got my booster. Each person is a little bit different. If you've had the COVID-19 virus and have recovered, another question that has come up is, should I still get the vaccination? Yes, absolutely. Just the COVID virus itself does not produce enough antibodies to be able to protect you against the possibility of getting sick with the virus. So if you have tested positive for COVID, we still encourage you speak with your provider first to confirm that you're appropriate around the timing, but the recommendations are for sure to please be vaccinated even if you've had the COVID vaccine. Thank you to all of our wonderful healthcare providers who continue to come to work every day and provide care in these challenging times, not only of the COVID pandemic, but the staffing pandemic. I read recently that there's over 500,000 healthcare workers who have exited their work since the beginning of this year. So it's been impactful. We appreciate the staff who is here and are working hard. We appreciate your patience with us as we are reduced in our staffing because of this second pandemic, the workforce shortage that we're all dealing with. We're grateful for the opportunity to serve our community. Thank you. And as always, if you have additional questions or information, please visit our website, sovahealth.com. Thank you and have a great day.